I think she's done a lot and she's crossing into the maybe too much for me. I'm Dr. Dara Liotta. I am a board certified facial plastic surgeon on the Upper East Side of Manhattan. I will say that she has definitely done quite a bit. She's 37. And I think that, among other things, she's had a rhinoplasty. I think that she's also had her buccal fat removed to get that sleeker look, the more contour down here. She's had lip filler. I think she probably actually had a brow lift or those thread lifts we were talking about to raise the brow. I think she probably had masseter Botox to slim the jaw as well. And in her after, I will say she is crossing a bit into that too done look for me. I think that she has a lot of stiffness in this area around the mouth. And for me, that's really a telltale sign of too much injection. You know, when you look at her kind of trying to smile, she's so stiff through here that it starts to look unnatural. So I think she's done a lot and she's crossing into the maybe too much for me. Yeah, I think she definitely has had a nose job. Especially when you look at these before and after pictures. Despite the fact that we rarely see the Kardashians without quite a bit of contour makeup and filters and editing.
Yes.
I think that even contour makeup could not make the nose as defined as it is in this after picture. And to be clear, Kourtney Kardashian is 42 years old. Like, she looks pretty darn good, I have to say. But she's definitely had a nose job. She's definitely had some filler along the way. No stranger to Botox, lip filler. And one other thing that she's probably had done is buccal fat removal.
What's that?
Yeah, so the buccal fat pad is a pad of fat that we have in this area of the cheek. And when that fat is full, it gives people kind of like a baby face look. And when that fat is removed, it gives you a much more sculpted look between the cheekbone and that area underneath. So even though she, again, often is seen with contour makeup where you'd highlight the cheekbone and put a shadow here, I think she probably has had that buccal fat pad removed. Kris Jenner, who is 65, has had work done. She definitely has a rhinoplasty. And in the before and after here, she has a rhinoplasty in both of them. She may have even had a revision in between the two pictures. And she has also likely had a face and neck lift. One of the things I would expect in someone who's 65 in the neck is to have what we call platysmal banding. They're kind of like these like little ropey bands that we get. And especially thin women like Kris Jenner get those ropey bands and some loose skin, and she doesn't have that. She has a very smooth area under the neck, and that tells me she has likely had a facelift or two. Yeah, so, you know, again, we're going to sort of couch this discussion in the idea that she's 23 currently.
Wow.
So by the time we first heard about her, she was a teenager.
Right.
You know? So again, there's so much skeletal maturity that happens during those, you know, late teen, early 20 years. So much of her transformation is natural aging, losing that baby fat. But I think that she probably also had some help along the way with some procedures. So for me, I definitely see a rhinoplasty to refine the nose. I also see a chin implant. I think that she did have that refining of the chin and the increased projection to help balance her profile. And that's really common to combine the nose job and the chin implant,
right.
Especially for young women. Yeah, so she talked about having broken her nose, and you can see in that before and the after picture, she has kind of that bump on the side here that really kind of only does come from breaking your nose, having that like sharp edge sort of jut out. In the after, I think the after picture, she's probably not at her final results from her surgery at that picture because the tip of her nose there is quite rounded. And if you look really closely, we were talking about like the magic of makeup. You can see she has a ton of highlight caked on the tip here.
Right.
What we look for in a rhinoplasty is for the light to be just like contour makeup, a line of light here and a tiny shine of light at your tip. And for her, I think she was still so swollen that that tip was quite rounded. And so she kind of like caked on the highlighter there. Yeah, so Lisa Vanderpump is 60. And I think you're right. I think she's always been maintaining. I think she's always had Botox. She's always had filler. I think she has had a facelift and a neck lift. I think her lower face here and that neck angle looks, again, too good for a 60-year-old. So I think she's had some work done. I also think she's no stranger to researching her plastic surgery, so she's probably had some good work.